So basically, the my topic is what causes the unhappy patient after a perfect cataract surgery. This is my topic today, and there is nil financial disclosure. Now, if you see this, how many of you have operated a perfect cataract surgery, achieve 6 vision, and yet the patient says, "Doctor, I am not happy." So just raise the hand. How many patients? Yes, it is near about 90% people. They are getting this type of patients. And when they get this type of patient, then what has happened? Modern cataract surgery has become a refractive surgery. Today, patient judge us not by snare acuity, but by quality of vision, comfort, spectacle independence, and whether the surgery met their expectation, not our expectation. So when patient is coming to you, he want his expectation to be fulfilled. Now, why patients are unhappy despite good vision? Because vision is objective and satisfaction is subjective. So the person who to whom you have operated, that person may or may not get satisfied because that depends on his nature. Now see why this happens. Patient expect vision like 20 years of age. Then the never wearing spectacles. He don't want spectacles. He don't want to give more money also. So reduce the money and give the vision. Then perfect night vision. In the night he should see more than day that he want. Reading newspaper without glasses and better vision than the other eye. And also the other person who is operated. That is a person who is satisfied person says मुझे तो बहुत अच्छा दिख रहा है and he will say उसको तो अच्छा दिख रहा है. He has got operated by 30,000. I am operated by 1,50,000. My vision is not good. So such type of comparison happens. Now what is the treatment? First is pre-operative counseling and second is under promise. What has happened when the trifocal we are doing, we say आपको चश्मा लगेगा ही नहीं. Why we say that? Because there is a compulsion that this patient, if goes for a premium lens, that will yield some money. So it is like that. It means it is a vicious cycle. So we don't want to promise, but patients they want such type of promises, and so because of that we over promise. So whatever thing happens, don't over promise. Then deliver properly so that patient will happy. Now one sentence changes everything. I am improving your eye, not making you 20 years younger. Because your eye has the problem. Unless and until you tell that, a patient will be unhappy only. Now what has happened? Why this happens? This I will also show the example. Most common overlook is the you can say patient says, I can see but vision is fluctuating. Now here look for dry eye, MGD, tail film that is not seen before. So once there is a cataract is seen, then goes to the counselor and counselor will go for the cataract surgery. Now here you can see the lubricants, warm compresses, lead hygiene. Now the treat inflammation. Many failed cataract surgery are actually dry eye because they are very unhappy. Because of that they are this one. Now other thing is residual refractive error. There is no surgeon in the world who will say that yes, if I will operate, patient will not get any refraction. That doesn't happen because that depends on his eye, not because of your calculation. And see, the small hyperopia or small cylinder, small myopia can produce dissatisfaction. If you see toric, he will say, no, I want monofocal. And if you get the, you can say spectacle, he will say, no, I don't want spectacle. But that time he has refused toric. So that thing happens because he don't want to give money, but he want to trouble you and then can produce dissatisfaction, especially in the premium IOLs. So whenever you are doing premium IOLs, my request is give your share time and not a counselor. Second thing is the treatment glasses. He will not accept. Laser enhancement you can do or piggyback lenses or in some cases you can remove the yeah, I will. Now the other thing is this dysphotopsia. Now see, very common. Positive dysphotopsia, halos, glare, strabismus, negative dysphotopsia, and one more thing, that is a temporal shadow must. If one eye is operated, patient will always say, in this eye there is a shadow in this eye. One eye. I don't know why. Both eye never says shadow. One eye there is always a shadow. Management see, here you will have to say it takes some time and that will disappear. Neuroadaptation, you have to tell it requires minimum 120 days. Don't say 90 days, 120 days. So that time he will forget. Treat dry eye if it is there. Then the sometimes myotics may help. Huh? They will help. I will not say. And don't do IOL exchange at all. Now the multifocal IOL dissatisfaction. Now here the patient complains is halos, reduce contrast. The company says that contrast is 93%. For the patient, contrast is normally 39%. It means just opposite. But company will just say, 93%. So we will purchase the lens. Night driving is difficult. So don't operate patient with multifocal when he is driving night. Remember, the visual acuity may still be 6.6, but patient is totally unhappy because he has paid more and so his expectation is very, very sky high. That is not possible. Now the treatment is counseling. The counseling is time. You have to say yes, neuroadaptation. See, one patient was there. He was having the that uh, some this myopia patient was told that उसको क्या था रागिनी वो myopia patient myelinated nerve fiber. One doctor told him कि you have myelinated nerve fiber. Patient's age is 18 years. After that he comes to me. No, I know patient has myelinated nerve fiber, so he has a problem. It means tell such a scientific thing that he doesn't understand. So you will have to tell that yes, it is a neuro adaptation and something another adaptation you can tell, and that will take some time. So unless and until he will tell the language that he doesn't know, it is not in the Google, then he will understand. So unless and until it is there and correct the refractive error, sometimes yeah, don't remove the lens. Now see the opacification if it is there, excellent surgery, excellent vision, unhappy. You can go for YAG, but before that see CME sometimes. Sometimes it is because of CME you are doing the YAG that will not help. And so because of that, vision may be 696, but patient says, I don't see clearly. Do OCT. Treat with NSAID, steroids, anti-VEGF sometimes if required. But I think it is very good. Now corneal problems, Namrata has just told, fuchs, persistent edema, irregular astigmatism, and treat according to the cause. Yes, it is because of that. Macular diseases, occult ERM or you can say early AMD, diabetic, always perform OCT whenever you are going to tell them. It means that will help. Glaucoma, vision is good, but I don't feel confident. Why? Because this is in his brain. Why? Reason? Peripheral field loss. There is no peripheral field. So he will say, I can't walk, but what can I do? So before the any treatment, you must tell them कि आप चल नहीं पाएंगे, नीचे का दिखेगा नहीं, because your vision is tubular. Show him tube. नीचे ऊपर कुछ नहीं दिखेगा. So unless and until you tell him 3, 4, 5 times, don't operate. Otherwise, he will reduce your age. Now, binocular vision, one eye is operated, other is not operated, problem. Then other eye cataract, anisometropia, treat second eye early if it is there. So that will help you. Now, these factors are important. Anxiety, depression, perfection. If the patient says, 5 times ask you the question, 5 times, 5 questions, don't go for premium IOL, 5 questions. Remember, If you will go for premium oil, your 5 years of life is reduced by that one patient. Nothing happens. If you will not operate one patient, nothing is going to happen. I will tell you, now I am practicing. If one patient, I refuse the patient. My other clinicians, they tell me, सर ये पेशेंट पेइंग था. मैं बोला पेइंग था, मेरे इधर के बाल गए, ये नहीं डालना है. क्यों डालना है? वाई? वो पेइंग है या नहीं है? जहाँ जाना है जाओ. और वो एक पेशेंट बताता हूँ, मैंने भेजा, मेरे नजदीक के डॉक्टर ने ऑपरेट किया. वो डॉक्टर मेरे पास आया, इसको कुछ समझाओ, इसको कुछ समझाओ. आप ही समझा सकते हो, क्या समझाएंगे? मैं बोला इसको मैंने हकाल दिया है, अभी क्या बताएगा? फिर वो पेशेंट मेरे पास आया, मैं तेरे को बोला अगर क्वेश्चन नहीं पूछेगा आई विल ऑपरेट. है ना? दिस इज वन पेशेंट को मैंने हकाल दिया था मुलुंड के हिस्से, वो आ गया, ऑपरेट किया. अब रोज फोन करता है, मुझे ये चाहिए. क्यों चाहिए? दिस इज वेरी डिफिकल्ट. सो दिस इज वेरी डिफिकल्ट. सो सर्जरी कांट satisfy this completely. Such patients you can't satisfy at all. And what is happy formula? Here, listen completely, don't interrupt. उनको सुनो. ऐसा पेशेंट को आखिरी बुला. है ना? ये सब पेशेंट है ना, इनको आखिरी में बुला. जब भी बात करना है, सी, हम प्रीतम नहीं है इधर, इसको हम वांडा बोलते हैं, वांडा. सो सच पेशेंट यू राइट डाउन इन योर फोन बुक वांडा 1, वांडा 2, वांडा 5. इट मीन्स वंस यू से वांडा, इट मीन्स व्हेन यू हैव गॉट द टाइम, दैट टाइम टॉक टू हिम. जो बोल रहा है वो बोलते रहेगा, तुमने या या ऐसा करते रहो. एंड उसके बाद सब सुनने के बाद बोला हाँ यू हैव गॉट वेरी बिग प्रॉब्लम, आके मिलो. है ना? सो लिसन कंप्लीटली, डोंट इंटरप्ट. उसको जो बात करना है करने दो, क्योंकि उसका सुनता कोई नहीं, तुमको सुनना पड़ेगा. बिकॉज ही हैज पेड यू. द अदर इज अ पी. साइकोलॉजी, अंडरस्टैंड एक्सपेक्टेशन, प्रॉब्लम आइडेंटिफिकेशन, फाइंड द एक्चुअल कॉज. Why? Yield solution. Every unhappy patient want hope. Never say everything is normal. Instead say your surgery is successful. Let us identify what is the problem in your eye. It means सब अच्छा हो गया है. क्या हो गया जरा देखते हैं. It means don't say कि ऐसा होगा. Practical. See, step 1 listen. Step 2 refraction. Step 3 slit lamp. Step 4 tail film. Fundus. Macular OCT. Visual field. And counseling. If you do this, then there is no problem. Golden rule is never argue. Never argue. If you argue, you are in the big problem. Don't argue. Never say no. See, your vision is 6-6, so you should be happy. Don't say that. Your vision is 6-6, but we are finding out the problem. Instead, say, I understood and I'm concerned for your problems and that I will solve it. So, never dismiss the symptoms. Examine before explaining. Examine. सब बैटरी से देखो, ऑप्थल्मोस्कोप से देखो, डायरेक्ट इनडायरेक्ट ओसीटी. हमने एक उसको नाम दिया एकेडमिक. सब फ्री करो और बहुत बार उसको सब तरफ बिठा दो. एंड देन द बेस्ट कैटरेक्ट सर्जन इज नॉट द वन हु गिव्स द शार्पेस्ट विजन, बट द वन हु क्रिएट्स द हैप्पीनेस इन द पेशेंट. सो दैट इज व्हाट इज द बेस्ट कैटरेक्ट सर्जन. एंड थैंक यू वेरी मच.
Excellent, excellent, sir. I think you are absolutely right. I think we have to listen to them. In the end, we have to take them to all the room without taking any money from them. Thank you so much, sir. And just in the continuation of the talk, I think Dr. Chandrasekhar Vavikar will be talking about the recent advances in biometric technique. But one key home message before Vavikar start, I think Lahane sir told that never ever do the lens exchange. Rather, neural adaptation, neural adaptation, neural adaptation. Where-
Neuro can say first time neuro adaptation, then say neurohumoral adaptation. So second time he comes and say, huh?
Amygdala.
Yes.
Amygdala, जो आप word ढूंढ रहे थे,
हाँ.
पैर को वो, but he taught so well.
हाँ, so बेसिकली कैसा है कि रोहित ने बताया है, ये पेशेंट के ब्रेन में प्रॉब्लम होता है. रोहित शेट्टी ने बताया है कि ब्रेन में प्रॉब्लम होता है. ऐसे पेशेंट को तुम ठीक नहीं कर सकते हो, बिकॉज दैट गोज टू द ब्रेन एंड देन ही इज नेवर सेटिस्फाइड. हाँ, go ahead.